Hello, thank you for stopping by. My name is Confidence Ogbomade. I'm a medical doctor in the field of obstetrics and gynecology. In this video, we are going to be looking at 10 abnormal findings that you can have in pregnancy that are actually normal. So we are going to be going through them now. And watch till the end to see if you can guess or if you correctly guessed any of them. And please, I invite you to subscribe to this channel and like this video. First on the list is milk secretion in pregnancy. Normally, at the end of pregnancy and then after delivery, lactation is established, but the cells that are responsible for the secretion of breast milk actually start functioning as early as the 16th week of pregnancy, and in some women even as early as 20 weeks colostrum can be expressed. So if you've ever, while pregnant, expressed breast milk, and not like you're breastfeeding an infant that you had in your previous pregnancy, you don't need to be alarmed. That is normal. Number 2, there are changes that occur in the blood pressure. The blood pressure drops, the systolic and diastolic blood pressure, they gradually decline, but this is normal. It is due to the reduced vascular resistance due to the hormone called progesterone. Progesterone plays a lot of role in the changes that occur in pregnancy. So if your blood pressure has dropped to 90/60, for example, you don't need to be alarmed. That is normal. Number 3, there is a hyperventilation that can occur with pregnancy because the volume of oxygen, let me describe it that way, but we'll call it the tidal volume. The volume of oxygen that you need and also your baby needs increases. So when you are in any environment where the oxygen supply is low, you tend to compensate by breathing faster than you should. So when such happens and you're not having that outside pregnancy, when you're not pregnant, you don't need to be worried. That is a normal finding of pregnancy. Number 4, there is the heartburn, reflux that occurs during pregnancy because the lower part of the esophagus becomes a little bit relaxed so that the contents of the stomach can spill up into the esophagus, and then you have that as heartburn. So that is normal. You don't need to get worried, and you can relate this to your doctor. You may be placed on some antacids. Remember, this does not replace the advice of your caregiver, your doctor, your midwife, but it's for you not to be alarmed and think that something very serious is going on. Number 6, there is reduced transit time. What I mean is this: when you eat, especially in the second and third trimester, when you take solid food, it feels like the food doesn't go down as fast as it's used to. So there is some slowing down of your intestines, and then it seems like the food doesn't go down as it's used to. So this is outside pregnancy, it is not the norm, but in pregnancy, when that happens, it is normal and it is expected because of the effect of the hormone progesterone. That is it again. Then number 7, the dark patches on the face, especially if you're dark skinned. These dark patches, sometimes from the face it goes down to the neck area. I'm sure you know this one already. If you've been pregnant, if you've been around any pregnant woman, you just find out that they get darker, and this darkness is called melasma. Some people call it the mask of pregnancy. So now you may be wondering, will I ever get back to my pre-pregnancy complexion again? Well, most people do, some don't, but you will not remain that dark after you give birth. So that is a normal finding of pregnancy. When we see that dark patch outside of pregnancy, we think about some other diagnosis, but in pregnancy it is normal. Where are we now? Number 8, leg swelling. So when we get really concerned, they find out that their legs are swelling up, and then the legs feel heavier and painful than they used to be. Once again, this is due to the increasing volume, blood volume, as well as the increasing uterus, reducing return of blood, venous return from the legs to the upper body. So this pulls down in the legs, and then the legs tend to swell up. But then the advice here is for you to raise your feet when you're going to when you're sitting down, and then avoid prolonged periods of standing. This is a way to address this leg swelling, and then you find that it recedes. But if the leg swelling is increasing rapidly, or even when you lie down it's still there, you need to be telling your doctor or your midwife or your caregiver about this. Number 10, frequent urination. I know you know this and you're wondering, why am I always, in fact from the first trimester I've been urinating frequently. Remember that your blood volume increases to match the need of your growing baby. Number 2, as the pregnancy advances, the uterus is getting bigger and is putting pressure on your urinary bladder. So every little volume of urine wants to go out, because the space, the capacity for the urinary bladder to accommodate more urine is reduced because of the enlarging uterus. So that is why you urinate frequently during pregnancy. And sometimes even at night we wake up to 3-4 times to urinate. So this shouldn't bother you. Now, an extra, bleeding gums. You may find out that your gums bleed easily. They feel spongier. That is also thought to be due to progesterone and then the hormonal environment that pregnancy brings. So you don't have caries and all, but it's still wise to speak with your health care provider. So how many are able to guess correctly? Do tell me in the comment section. If you benefited from this video, please like, share and subscribe. See you in the next video. Thank you.